This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
For fast, triple action relief of pain, fever and inflammation, use Grandpa. Trust Grandpa, South Africa's #1 pain reliever. Available in powders and tablets.
Until fairly recently, pain was considered a symptom of disease or condition, even a natural part of aging. As a result, most pain went under or improperly treated. I under teenies at the Wits Donald Gordon Medical Center to find out more from our resident GP.
As with everything related to your health, it's essential to be as well informed as possible. Learn to identify the types of pain you may suffer from and find out what treatment options are available to you. Dr. Lerato, why does your body feel pain? What physically happens?
To put it simply, the body is made up of millions of nerve fibers, all stemming from the brain and the spinal cord, which is the central nervous system, going out into the peripheral nervous system, which is the rest of the body. So we become aware of pain when receptors in the peripheral nervous system send signals to the brain via the spinal cord, telling it that we're physically being hurt. In return, the brain sends messages back to the peripheral nervous system, telling the body what to do to avoid further being hurt. Furthermore, the brain stores the memory of the pain so that in future you can avoid this pain if possible. And pain memory is stored with emotional memory. That's why some of the pain that you feel can make you cry.
What are the most common sites of pain?
Well, any part of the body can experience pain really, but the most common sites that I see in my practice are toothache, headache, tummy ache, backache, and earache. So when somebody says, "I've got pain, doctor," I know it's going to be one of those 5 things.
What over-the-counter medication should you choose for pain relief?
The objective of taking pain relief medication is to stop the chain of pain signals going back and forth between the body and the brain. So one should take something that is going to reduce or even stop the chemicals or hormones that are facilitating this process. Aspirin or paracetamol-based over-the-counter pain relief medicine is commonly used for this purpose.
How common is backache?
Backache is actually very common. We use our backs on a daily basis for various purposes and functions, and we're not even aware of it. A typical daily activity is sitting at your desk while working. So if you're slouching or having incorrect posture, this will lead to backache. Your back supports you while you're walking, while you're sleeping, while you're playing sports, etc. So if you don't have strong core muscles, which include the back muscles, you will experience back pain. So any strain to the back, whether slight or major, may result in muscle, ligament, or bone injury, which then could in turn result in back pain.
What can you do to relieve toothache before you see the dentist?
The best way is to first and foremost avoid toothache from happening by following appropriate dental practices, which includes seeing your dentist every 6 months. However, if you're unfortunate enough to experience toothache, you can use home remedies such as saltwater gargling or using an appropriate mouthwash.
Thank you, Dr. Lerato, for sharing your views. I'm sure our viewers will have benefited from your knowledge and wisdom. I know I have.
It's my pleasure.
If you have any concerns or queries about this topic, we suggest you consult your medical practitioner.
For fast, triple action relief of pain, fever and inflammation, use Grandpa. Trust Grandpa, South Africa's #1 pain reliever. Available in powders and tablets.